Blast injuries from explosions can cause damage to the brain. Now, it's not necessary for any object to actually strike the head for this damage to occur. Just the blast over pressure wave may be enough to damage the delicate structures within the brain. This is an example of the dramatic results of an atomic bomb, showing objects being blown away from the explosion and then being sucked back toward the explosion.
On the silent desert, the test objects waited.
H minus 10 seconds. 9, 8, 7, 6, 5, 4, 3, 2, 1, 0.
The initial positive phase of the blast wave, the blast over pressure wave, pushes objects first away from the explosion, and then it's followed by a negative pressure wave, an under pressure wave, which can suck debris and objects back toward the explosion site, causing further injury and damage. We'll go into the detail of this later in this video. Now don't worry, the human figures seen in this video were not real. They were mannequins dressed as people. In the blink of an eye, a blast wave from an explosion can cause a traumatic brain injury, a condition that can have profound and lasting effects on an individual's life. This type of injury, known as blast-induced traumatic brain injury, can play a significant role in damage to the brain. Now, I live in Houston, and we see blast injuries as a result of explosions which might occur at oil refineries, chemical plants, and other industries, which we'll discuss later. Blast injury refers to the physical trauma resulting from the explosive energy released during an explosion. It can affect the body in various ways, including traumatic brain injury. Now, the brain, I want you to know, is particularly susceptible to blast injuries due to the rapid and intense pressure waves which can pass through it during an explosion. Now, how does this happen? What are the causes of these blasts? What type of damage can they cause to the brain and to other parts of the body? How do I recognize the injuries? What's the difference between a sound wave and a blast wave? Do blast waves travel at supersonic speeds? What's the physics behind blast waves and injury to the brain? Welcome back, my friends and my fellow seekers of truth and knowledge. I'm Dr. Gary Krause, neurosurgeon and founder of the Krause TBI Institute in Houston, Texas. The Krause TBI video podcast is dedicated to providing information and updates about the brain, brain function, and traumatic brain injury. First, let's dive into the causes of blast injuries. Blast injury to the brain are the #1 cause of brain injury in the military population, but they also affect the civilian population. Blast injuries to the brain can result from explosions in oil refineries, chemical plants, and other settings. And they're a significant concern in urban areas across the United States. These injuries are caused by the force of the blast wave. It's a powerful pressure wave that expands outward from the explosion site at high speeds. The blast wave can cause a unique class of injury known as explosion or blast injury, and it's characterized by anatomical and by physiological damage resulting from a direct or a reflective overpressure wave. Now, let's go over the causes of blast wave in the military population. These include what are known as IEDs, improvised explosive devices, landmines, grenades, mortar shells, rocket-propelled grenades, known as RPGs, artillery shells, suicide bombs, car bombs, and what are known as vehicle-borne improvised explosive devices, and aerial bombs. Now, what about the civilian population? In the civilian population, we also see explosions in factories, industrial accidents, terrorist attacks. There are accidental explosions, transportation accidents, mining explosions, construction blasting, and natural gas explosions. Let's go into a bit into some of these. Explosions in factories. They can occur in refineries, chemical plants. Mines can release massive energy. This can lead to blast injuries among workers and nearby residents. Now, the brain is particularly vulnerable to blast injuries because of its sensitivity to pressure changes. The primary blast wave can impact the body and cause concussions, closed and open traumatic brain injuries, and injuries to other organs in the body, which are solid and hollow organs, without any external signs of trauma. These injuries can be serious. They can include various organs of the body, including the lungs with lung damage, the ears damaging the tympanic membrane in the middle ear, abdominal injuries and hemorrhage, eye injury, and concussion, which is a traumatic brain injury. Other organs of the body may also be damaged. The brain is a vulnerable target for blast exposure. The explosion or the blast injury pressure wave passes through the brain and it can significantly disrupt brain function. This can lead to a wide variety of symptoms, some of which might appear immediately after the event. Others may occur days, weeks, months, or later after an event. Physical symptoms from this can be very varied. Might include headaches, nausea, fatigue, problems with speech, dizziness. There could be sensory problems, blurred vision, changes in the ability to smell, and other findings can also occur. Now, in addition to these physical and sensory symptoms, individuals with a blast traumatic brain injury can experience other problems and difficulties. There can be significant cognitive and behavioral changes. These might include difficulty with concentrating, memory problems, mood swings, depression, anxiety, PTSD, post-traumatic stress disorder. There could be long-term cognitive, emotional, and behavioral changes which may persist. Now let's go over a bit of detail about the 4 types of injury which are caused by blasts. Blast injury to the brain, known as blast-induced traumatic brain injury, differs from other types of brain injury in several important ways, primarily due to the unique mechanisms of injury which are involved in blasts. Now, unlike traumatic brain injuries, which are caused by physical impacts, such as from a car accident or a fall, a blast traumatic brain injury results from exposure to the intense pressure waves generated by the explosions. These injuries can be categorized into 4 classes based on the type of injury. And we'll go over these. These are the primary, secondary, tertiary, and quaternary blast injuries. First is the primary blast injury. These are directly caused by the overpressure wave of the blast itself. The wave can pass through the brain, causing diffuse axonal injury and contusions and other forms of brain damage without any signs of external injury. The rapid changes in pressure can disrupt brain function and brain structure, and it can lead to a wide range of neurological symptoms. Next, second, secondary blast injuries. Now, these can result from flying debris and shrapnel that penetrate the skull and the brain. These injuries are similar to penetrating head injuries from other causes, but they're unique in the situation of an explosion because of the variety and the velocity of the projectiles which are involved. The next type, third, tertiary blast injuries. These occur when the force of the blast itself throws the individual against a solid object, causing blunt trauma similar to that seen in car accidents or in falls. But the force and the unpredictability of blast-induced tertiary injuries can lead to complex patterns of brain damage. And fourth, the quaternary blast injuries. These include all other explosion-related injuries, such as burns, inhalation of toxic gases, and exposure to the blast environment, which can indirectly affect brain health. The complexity of blast traumatic brain injury arises not just from the direct impact of the blast wave on the brain, but also from the combination of multiple mechanisms of injury occurring simultaneously or sequentially. Now, this multifactorial nature can lead to a wide spectrum of physical, cognitive, emotional, and behavioral symptoms, and it ranges from concussions to severe brain damage. Next topic I want to discuss: how do we diagnose blast injury to the brain? Now, diagnosing blast injury to the brain or blast-induced traumatic brain injury involves a multifaceted approach due to the unique and the complex nature of these injuries. First in the evaluation is, as with any medical exam, the clinical assessment and the history. Now, a thorough clinical assessment, including a detailed history of the patient's exposure to the blast, is crucial. This helps in understanding the nature of the injury. It assesses for loss of consciousness, for disorientation, post-traumatic amnesia, and identifies symptoms consistent with the blast traumatic brain injury. These might include difficulties with sleep, vision, thinking, hearing, and other issues. Next, second, the neurological assessment for impairment. Assessing neurological function is the next step in diagnosing a blast traumatic brain injury. And this can include evaluating cognitive, sensory, motor functions, and it may identify impairments that result from the blast exposure. Next, third, neuroimaging. Advanced imaging techniques play a role in assessing blast TBI. Now, while conventional CAT scan or CT scans of the brain and conventional MRI or magnetic resonance imaging scans of the brain are commonly used in TBI diagnosis, they may not detect the subtle brain damage caused by blast waves. More sensitive imaging techniques such as DTI, stands for diffusion tensor imaging, SWI, stands for susceptibility weighted imaging, and FLAIR images, stands for fluid attenuated inversion recovery images, are more useful for identifying signs of axonal injury and microhemorrhages in the brain. But it's important to remember, although these scans are more sensitive, they may also be negative in findings after blast traumatic brain injury. Other types of imaging might include functional MRI, SPECT scanning, magnetoencephalography, MEG, and others. Let's go over a fourth type: neuropsychological testing. Assessing the cognitive function of a patient through neuropsychological tests can help also to diagnose a blast traumatic brain injury. It may identify impairments in memory, attention, and executive function. This approach can also be useful in tracking the progression of symptoms and effectiveness of treatments. Now, there are many other medical specialists and procedures and evaluations that may also be utilized and very helpful in diagnosing and treating patients who have suffered a blast traumatic brain injury. Next, let's go a little bit over the physics of blast waves. Now, I don't want to lose anybody by getting into too much detail. I do enjoy physics because before going into medicine, my degree was in physics. But I won't go into a lot of detail, just a little bit here, because I think it's important to understand physics of blasts in order to get a better sense of what actually happens during a blast. Now, the physics of blast overpressure wave involves several key principles, which explain its formation, its propagation, and the damage it can cause. Now, when an explosion occurs, it releases a large amount of energy in a very short time, leading to sudden compression of the surrounding medium, whether that's air, water, or what have you. In this case, generally we're talking about air. This may result in an increase in pressure above atmospheric levels. We all are surrounded by atmospheric pressure, but this may have a sudden increase in that pressure, and it's known as an overpressure. The overpressure wave, otherwise called the blast wave, can propagate outward from the explosion site at supersonic speeds. The blast wave consists of a leading shock front of highly compressed gases, followed by a region of lower pressure, known as the negative pressure phase or the underpressure wave. Now, this rapid transition from a high pressure to a low pressure wave can cause significant damage to structures and to living tissues. The magnitude of damage depends on several factors. These include the peak of the initial positive pressure wave, the duration of the overpressure, the medium in which the explosion occurs, and the distance from the explosion, and the degree of focusing due to confined spaces or walls. Blast waves exhibit properties which are similar to wave phenomena in general, and these include the ability to diffract, to refract, and to reflect. Now, when a blast wave encounters a boundary between two materials, it can reflect and interact with other waves, and it can create complex wave patterns which can amplify the potential damage. The initial positive pressure of a blast wave is followed by a negative pressure wave, which can suck debris and objects back toward the explosion site, further causing additional damage. The extent of damage is also influenced by the environment in which the explosion occurs. As an example, explosions near or within solid surfaces can amplify the blast wave due to shock wave reflections, and it can significantly increase the destructive potential. Now, in a blast wave, the difference between positive and negative pressure waves lies in the respective effects and the phases during the explosion. So, a positive pressure wave or overpressure wave is the initial shock wave that emanates from the explosion site. And as we said, it's characterized by a rapid increase in pressure above atmospheric levels, which compresses the surrounding medium and propagates outward at supersonic speeds. This wave can cause significant damage due to its high pressure and the high velocity or speed at which it moves. Following the positive pressure wave, there's a negative pressure phase known as an underpressure or suction phase, and this phase occurs as the pressures decay back to ambient levels after the shock front has passed. The negative pressure phase is usually longer in duration than the positive phase and involves a drop in pressures below atmospheric levels, which creates a partial vacuum. This can, as we discussed, cause objects and debris to be sucked back toward the explosion site, potentially causing additional injury. The positive phase is generally considered more destructive due to the higher peak pressures and the rapid onset, which can result in immediate and severe damage to structures and to tissues. The negative phase, while it's typically less intense, can still contribute to the overall damage from the blast, especially in confined spaces where the effects of the suction can be magnified. I'd like to discuss what's the speed of the blast wave. The blast pressure may be supersonic, as it travels faster than the speed of sound. The passage of this shock wave usually lasts just a few milliseconds, but its intensity can cause significant damage. The extent of damage from the blast wave mainly depends on factors such as the peak of the initial positive pressure wave, the duration of the overpressure, the medium of the explosion, the distance from the explosion, and the degree of focusing due to confined spaces or walls. In comparison to sound waves, which are pressure disturbances that propagate through a medium at the speed of sound, blast waves are much more intense, and their destructive effects occur because of this higher pressure and the supersonic speed. The rapid transition from high to low pressure can cause significant damage to structures and living tissues, which is why blast injuries are particularly severe and complex. Understanding the physics of blast exposure waves is crucial for assessing the effects of explosions on structures as well as on the human body, and for designing protective measures and treatments for blast-induced injuries. Now I'd like to discuss how does the blast pressure compare to sound pressure. Blast pressure and sound pressure are both forms of pressure waves, but they differ significantly in their intensity and in their speed. Sound waves are typically pressure disturbances which travel through a medium at the speed of sound, which in air at room temperature is about 343 meters per second, or about 1,125 feet per second. These waves consist of a repeating pattern of high pressure, which are compressions, and low pressure, which are rarefactions, regions moving through the medium. Now, in contrast, a blast wave, particularly from an explosion, involves a rapid release of energy that generates a shock wave or an overpressure wave. This wave initially travels faster than the speed of sound, which makes it supersonic. The leading edge of the blast wave, known as the shock front, consists of highly compressed gases, and this can cause immediate and severe damage due to its high pressure and its rapid velocity and propagation. The peak pressure of a blast wave is much higher than that of a typical sound wave. The impulsive nature of a blast wave results in a near instantaneous rise to a high peak pressure, which is significantly greater than the pressure fluctuations associated with sound wave. The blast wave's overpressure phase is followed by an underpressure or negative pressure phase, where the pressure drops below atmospheric levels, and this negative phase can also cause damage by creating a suction effect which can pull objects and debris back toward the explosion site. So, in summary, blast pressure differs from sound pressure in that it may be supersonic, it may have a much higher peak pressure, and a rapid onset, leading to more intense and destructive effects compared to pressure fluctuations of sound waves. Thanks for being with me today. If you found this video helpful, please hit the like button. Also, remember to subscribe to our channel so that you'll stay updated about new videos on the brain, brain function, and traumatic brain injury. Please leave your comments below because they're helpful for other viewers and also for me as well. Now, until we see each other again, please remember to stay curious, stay optimistic, stay dedicated, stay kind, and stay safe. Thanks for watching.